Portage County Economic Response Team's Economic Recovery Briefing, recorded Wednesday, April 29, 2020.
So I think we'll go ahead and get started. Thanks everybody for joining us. We'll keep you on mute. We have two, I guess, kind of formal presenters today. We also have some opportunities for maybe some other updates from Ryan and myself as we go through this, but we want to get into the presentations first. We decided we talked about bringing back Gary Garski. Gary is a Portage County Health Officer. He has his fingers on the pulse of health in Portage County and I would say the state and nationally as well. A good handle on all that. After Gary, we'll have Attorney Dan Schmeekley from Anderson O'Brien. Dan will give us a little bit of a look at, as we begin to look towards recovery, talking about some business safety in this COVID-19 environment. And then Ryan will wrap things up with a little bit of an update on the grant from the city, as well as any questions. Again, please, if you have questions, you can either email them to Ryan based on the site, or else you can, or on the press release you sent out, or else you can certainly post them on the site, the group chat box, and we'll get to those as we can. I guess I'll do one other plug right now too. We're also going to do this on May 6th. We've got a couple folks already set on May 6th. Brian Fermella from Anderson O'Brien will talk about the workplace from the employee perspective. And we're also going to have, we're looking to have Sarah Meany, who's the tourism director for the state, as well as Sarah Brish, who's our own tourism director for Portage County area, and also maybe somebody from WEDC, Wisconsin Economic Development Corporation. So just a little teaser for you to stay on next time. So enough of me talking. Gary, I saw your name on the phone or on the Zoom. We'd like to, if you could unmute yourself and give us an update on the Portage County Health.
Okay. Yep. Okay. Hi, everybody. So Ryan, do you have my slides? And while those are coming up, I will add that we do have another positive case that was identified yesterday in Portage County, so that gives us 5 currently, 4 of which are recovered. So again, Todd had asked me to talk to you all about the Badger Bounce Back Plan. This came out last week from Governor Evers' office. This is the plan that is based upon the federal guidelines for Opening Up America again. It's the Wisconsin version of that. And it really is about the next phase, about following up with the work we've been doing around trying to mitigate the presence of the COVID-19 virus in our communities. So really it's about moving in from boxing in the virus to opening up Wisconsin again. The plan again is to reduce the presence of COVID-19 by increasing investigation through testing as well as contact tracing. And then hopefully this will begin to lower our level of the presence as well as the deaths that we're seeing as a result of the COVID-19 virus in our communities. At the same time, it's about not creating a surge within our medical systems. So that said, it's kind of in part, each part of this plan is dependent upon the other. Looking at that circle we see on your screen, the red dot is where we are right now, is that we're all under our safer at home order still. We're currently under order number 28 that took effect last Friday at 8 a.m. and it's supposed to be in effect until May 26th. But again, it's currently being challenged at the Wisconsin Supreme Court, so we'll wait on the outcome of that trial. The next phase is the purple phase, which we've been working on in health as well as DHS and with medical partners for the last 3 weeks, and that is to create more access to testing. I will tell you that all 3 of our medical systems here in Portage County have increased their testing. With that said, there was a time we were only looking at tier testing of like healthcare workers, response workers, and those that were critically ill that needed medical attention. That's now expanded to looking at people who even have mild symptoms of COVID-19. We're still not to the point yet of testing people who are asymptomatic, and that's okay because we're now looking at antibody testing being available as of today in Portage County, both through, at least I know, through the Ascension system, and I believe Aspirus will be online shortly with that as well. The difference is, again, the COVID-19 testing requires a swab, known as an NP swab or a rapid test. Those are available both clinically if you're going to be in-house for medical treatment and or through drive-through clinics such as Aspirus. And the antibody testing is done through a blood test that's, again, done under a doctor's order. So those are available to us currently in our county. And I will say we're currently looking to bring in on the week of May 11th the National Guard to do supplemental testing here in Portage County of at least 500 tests over a course of 2 days. And that hopefully will be held at Health and Human Services, but wait for more information on that. Please put our application for that today. After having more access to testing, obviously then we'll have a need to expand our contact tracing. So again, contact tracing occurs anytime anyone is tested. And then from those tests, if they're identified as a positive case, there's additional contact tracing. And even for people who are tested who test negative, there's still contact tracing as to knowing, you know, why do you think you have symptoms and where do you think your symptoms came from. And really this is all in regards to the darker blue circle about trying to aggressively track the spread of the virus itself in our community. And of course, and this is all dependent upon the turquoise circle, which is having more access to PPE and supplies. Where we stand right now from our medical systems, I'm being told that they have enough supplies to help out with the additional testing that they're doing both in-house and through their drive-through systems. And obviously, if there were ever a surge in our medical systems, it would need more PPE. But for currently, we're set with the current testing needs that we have in our community. And then with that, then the green circle says you need to increase healthcare system capacity. So obviously, as we do more testing, we will find more positives, and then that might lead to people being intubated or being medically treated in our healthcare systems. Currently, we do have beds available, and we do have space available, negative pressure, to provide people medical treatment. And hopefully that will stay the course. And then finally, the olive green circle says, you know, that we do the Badger Bounce Back Plan. So again, as these things are all being addressed and they're all kind of working in tandem, if one of these steps fails, it causes us to take a step backwards. But I will say, as of today, with emergency order number 34, we're starting to see the dial turn slightly in that, you know, we're allowing for more curbside service, especially with the non-essential businesses in our community, to provide customer service. So again, we're making enough progress in these other elements of turning the dial that we're now to a point where we're, you know, it's okay for us to say, let's increase some businesses in our area. And like the slide said, none of these steps would be possible without the others taking place. So again, there's a failure in the system, it will cause us to take a step back. And the next slide, please. So Todd had said to me, can you talk to me about the gating criteria? And again, the gating criteria came from the federal plan, and it's also reflected in the Wisconsin plan. This is kind of showing again that this concept of trying to box in COVID-19 so that we can reopen Wisconsin. And again, we kind of talked about these already. And that, you know, identifying symptoms, which leads to identifying more cases, making sure we don't tax our healthcare system. This is done then through additional testing, followed by contact tracing, and obviously they need to have more PPE or protective equipment for everyone involved, from testing to contact tracing to isolation and quarantining of individuals. Again, this is all based on science. These are the benchmarks that we know are measurable, and helps us to gauge our success in attacking these or addressing these in our community. Next slide, please. These are the gating criteria specifically in Wisconsin, again, based on the federal system. Again, so again, you know, keep in mind that COVID-19 is like any other respiratory illness. It is a respiratory illness and is very similar to what we call influenza-like illness, meaning that it does, you see symptoms of fever, cough, body ache. So it's very similar to what we see for influenza, but again, it's not. It's COVID-19. So with that, you know, there are these symptoms out in our community, people having either all symptoms, some of the symptoms, or having no symptoms. But it's important to identify these people and make sure that they're either placed into quarantine or isolation for a period of 14 days so that they're out of circulation, so that we know other people aren't being exposed and possibly contracting the virus from those individuals. This will eventually cause us to see a downward trend in both the number of cases that we're seeing in Portage County as well as Wisconsin, as well as seeing downward trends, which we already are, and things like our normal influenza and influenza-like illnesses, including RSV. And again, that downward trend is for a period of 14 days. And of course, then, you know, the other gating criteria is around our medical system and making sure that we don't create a surge to which they cannot address. So with that said, you know, they will treat all patients without crisis care. and then we will have robust testing in place so that we can test anybody who wants to be tested, and that is currently is beginning to happen in Portage County as well as throughout Wisconsin. Now, people will say, but, you know, and I've heard this last week up until we had our fifth case identified, Gary, we haven't had any positive cases in 3 weeks. What's going on? Are we safe? And I also heard this morning, well, we had 4 cases and they're all recovered. Keep in mind, COVID-19 is very fluid. It does not observe county borders. It's really, truly everywhere. And when we look around the state, we're still seeing high incident rates, especially now in the Green Bay area with the meatpacking plants. And again, you know, if people were true to staying at home and not crossing across county lines, I would say you're probably right. You know, people here have practiced safer at home, and we are safer in our community. But since people do travel, and since we do have commerce that occurs in and out of our county, you know, we're always going to be susceptible to the introduction of our virus here. And so, again, that's why this criteria is Wisconsin-wide and not county-specific, and that we really have to move as a state, not just as a county individually. All right, next slide. And again, this is kind of how this looks from a public health perspective. Again, these are the core state responsibilities that require public health to do more testing as well as our medical systems. I will tell you currently the state of Wisconsin is just shy of 11,000 tests weekly. Our goal is to get to a point that we can do 85,000 tests per week, which would be around 12,000 tests per day. I will tell you we're getting better turnaround time, especially with the rapid testing that is occurring in-house of things like the Ascension system. And that, you know, we want to have results back within 48 hours from the time they're taken from the patient or the person that was tested. I will tell you that the case we identified yesterday, that case was tested on the 23rd of April, and we got notified on the 28th of April. So again, you can see there was like a 5-day lag from the time they were tested to the time that it was announced that they were positive. Moving around the box then, if we go from testing again, that's all based upon the availability for testing is based upon available PPE. And again, supporting the fact that we don't want to create a medical surge. Obviously, through testing, we will identify more positive cases. Those people will be placed into isolation so that they're at home, and they also would need a place to isolate. We are currently working on the fact that we have some folks that in the future might not be able to isolate at home, whether they be like in a facility like Salvation Army, or they simply, based upon their family size, it'd be safer for them not to isolate at home so they don't infect their family. And so we are working to establish an isolation facility here in Portage County. We've had 3 other attempts. So far they have failed, and we're now working on 2 other prospects that hopefully will pan out for us to have an isolation facility here. Isolation then controls the spread, and that leads, of course, to contact tracing of their contacts once a positive case is found. The goal at the state is to have 1,000 more contact tracers brought online. Currently, they are using National Guard folks to help them out with the outbreaks we're seeing in Milwaukee and the Green Bay area. But the goal would be to have additional contact tracing available throughout the state. Here in Portage County, I currently have public health nursing folks who are either have reduced hours or have been laid off because they were school nursing. So, you know, for us, when we bring this National Guard testing in, we'll be bringing our staff back, and they will be serving to help us with contact tracing and other needs of that testing days set up for May. But really, it's important for us with contact tracing to make sure that we contact every known contact, close contact of any suspected case, whether it be test negative and or especially for those that test positive. And again, finally, you know, placing people into quarantine because again, people in isolation are known positives to the disease, so we know that they have the disease. People who are placed in quarantine have been exposed to the disease, and really the purpose of quarantine is then to observe them for a period of 14 days to see if their symptoms change from being well to being ill. And of course, obviously, if they become ill, then that requires more contact tracing. And then all this then is controlling the spread. So any questions on that at all? I know I'm trying to rush through this, but I apologize.
We have a couple of questions, Gary, but we can wait. And are you finished, or do you have a couple more slides? I don't remember.
Sure. Well, then the last thing I have is a slide. And it's actually like a 2-minute little video from Health Watch Wisconsin, which kind of explains the whole Badger Bounce Back plan. So if you want to click on that, and it's really a good summary. It will have a little ad typically that we can wait 1 or 2 seconds and then skip the ad if it goes live for you. It should. What do you think, Ryan? Is it going to work? If not, we can take questions.
Just give me 1 second.
Sure.
Gary, let me run one question by you while Ryan's getting
Sure.
that set up or trying to. One question was, can you explain how they are calculating the 14-day decline?
So again, the 14-day trajectory is really based upon the number of tests that are being completed versus the number of positives that we're seeing. I will tell you right now, when we provide you with the summary, it looks like we're constantly adding positives, and that is the case. But if you look at the number of positives added per day or identified per day, that number has been decreasing. So if you go to dhs.gov under the Badger Bounce Back Plan, they have some infographics on there that are now trying to project the downward trajectory. So again, all of this work has been around us trying to flatten the curve. And, once we hit the peak of what we expect to be our highest number of cases, which should be about anywhere from 18 to 20% of our population in Wisconsin, we'll then be down on the downward slope of that curve. And that's what this downward trajectory is referring to. All right.
When Wisconsin's Governor Tony Evers unveiled his plan to reopen the Wisconsin economy, it's called the Badger Bounce Back Plan. This comes on the heels of his April 16th decision to extend the safer at home order that we have in the state of Wisconsin through May 26th. The Badger Bounce Back Plan outlines important criteria for Wisconsin to be able to reopen its economy in phases when it is safer to do so. This comes to Wisconsin as emergency order number 31, and it includes important steps to make sure workers and businesses alike are prepared to reopen. Ways to make sure you're ready to go would be to bolster contact tracing, testing capacity, that personal protective equipment resources, and healthcare capacity. And right now in the state of Wisconsin, it is not in a place to make this happen. The plan is informed in part by the President's plans for opening up America again that announcement on April 16th as well. And again, as the governor said, we're not meeting the President's criteria in the state of Wisconsin, so we are not yet ready to full-fledged open up our businesses. But they do establish some key metrics in the plan over 3 phases that will help us get us to that path. And again, it centers on testing, tracing, and tracking. They also, in the plan, outline some state responsibilities, enhancing some of those personal protective equipment supplies, working closely with long-term care facilities, and monitoring conditions over the next several weeks. There are additional guidelines for both individuals and employers to make sure they are feeling safe and healthy. Governor Evers stated in his press release when announcing the Badger Bounce Back Plan that it is about the resilience of our people and our state. And he says, while being safe at home continues to be important, this plan is an all-out attack on the virus. He said it begins the process of preparing our businesses and our workforce for the important planning that will result in a safe and logical reopening of our economy. And we've given you some resources in the description below to read the plan, the Badger Bounce Back Plan, and read that emergency order from which it originates.
Okay, so the
I
sound.
If that audio wasn't the best, and I can send people the link to that if you want to review that on your own.
Actually, the link is now on. Ben posted it on our chat box, and we can maybe add that link to the presentation. Couple other quick questions, Gary. Can you speak to how much testing has increased of late in our community?
So again, keep in mind that our 3 medical systems are currently doing the testing in Portage County. I will tell you that we roughly get anywhere between, or I'd say roughly 30 a day for tests coming in that we have to put into our WED system and then follow up on. Right. And that is a significant increase where before, we get, 4 to 5 per day.
Another question was, at what point is a person no longer contagious once they've contracted COVID-19?
So again, there's an issue with that, and that, again, we take our direction from DHS, which is the Division of Health Services in Wisconsin, and there are multiple definitions as to what is truly meant by recovered. We're going with the DHS definition and saying that our recovered individuals have all been diagnosed over 30 days ago, and they're currently still alive. With that said, we're seeing that people who have contracted COVID-19 will probably have lifelong, in most cases, some cases, issues following the disease. And so, not saying that they won't become positive again, but they're having some other health issues related to the fact that they contracted the disease in the first place. And that's part of the problem we're having, and really saying someone has truly recovered from the disease.
Okay, thank you. Another quick one here. Are you allowed to say, was the fifth person at all related to the previous 4 cases or connected at all?
I can tell you they were not. All 5 of our cases are, well, the current case is not related to the other 4 cases.
Okay.
In our case count, 2 of the cases were related.
Okay. And then one last one before we get to Dan. There's a lot of news about poor antibody test. Is the antibody test started one of the 4 approved by the government?
So again, the newest antibody test is looking at something that's in your blood. It's a marker that shows us, it's a yes or no kind of question saying, were you exposed to the virus, yes or no? For us, these will be reportable to us because, again, being a yes or no question, and it's on the PCR level of the antigen itself. We're not saying that you're positive, but we're treating it as if you were exposed to the disease. That makes sense.
Okay.
And again, with that said, it's not going to tell us whether or not you have immunity to the disease. It simply tells us that you were exposed. And we can't tell on the current test at what point you were exposed and for how long you've had the antigen in your system.
Sure. And Gary, I realize these are really tough questions because a lot of these are first, and a lot of things haven't, are still being tested. And also, thanks very much for giving us your answers. We realize I know you're not trying to skirt around anything. You're just trying to be careful how you answer them, and you've done a great job. So thanks very much. We'll see if there's any other questions that come up. Are you able to stay on through the end?
I am.
Okay, good. So we'll see if there's any other questions at the end. And otherwise, let's turn Dan Schmeekley from Anderson O'Brien Law Firm has agreed to join us. And I guess if you talk about uncertainty, some of the things Dan's going to be talking about are difficult. We want to talk about getting into recovery and what is and isn't, I don't know if the word allowed is correct, but Dan, if you could give us some indication of what we might expect as it relates to the businesses as we move forward with COVID-19 and eventually reopen our economy.
Sure. Thanks, Todd. My name's Dan Schmeekley. I'm with the Anderson O'Brien firm in town. As every lawyer has to say, I'm not rendering any specific legal advice. Also kind of unique here, I'm not giving medical advice, even though it might be fun to do so. The information I'm presenting today, I researched today as well. It's going to be out of date in a week, but some of the principles will remain constant. The presentation itself is pretty straightforward. It's how do you protect your business from liability and where that liability would come into play. And the most important thing to remember is that protecting your business from a lawsuit or from liability, it's also great because it protects the health and safety of your employees and your customers. The fundamental question that a business needs to ask if they're reopening is what reasonable measures can I take to prevent the spread of COVID-19? And so keep that question in mind. And there's a lot of good guidance. This presentation was pretty easy to prepare because everything I'm going to say has been written by an authority on it. So my goal is just to provide you with the information you need to make basically the best choice as to what is reasonable for your business. One other proviso before I jump into the material is I'm not covering the topics that will be covered next week that deal with employment benefits, employee-employer relations, ADA compliance, employment law, because a lot of that stuff is changing really quickly too. My colleague Brian Formella will speak to that. So the first question is when and how and why could a business be liable if a customer or employee contracts COVID? And it's actually a broader question because there's case law out there from other diseases, hepatitis, where people have contracted that, whether in a hospital environment, and then filed a lawsuit. So this isn't totally a unique situation. But one source of law is the Wisconsin Safe Place Statute. It's exactly as the name implies. Wisconsin businesses have a duty under Wisconsin law. There's a statute that says they have to provide employees, customers, and frequenters with a safe environment. So everyone knows employee and customers. Frequenters are just people that enter the business. So basically anyone other than a trespasser. You have a duty to maintain a safe place of business. That means safety devices, safeguards, things like that. And COVID's been around long enough that we know what those are. If you go to Lowe's, if you go to a grocery store, you see the plexiglass, and we'll talk about specific things, but that all goes into their safe place duty and what a grocery store would need to do, what a hardware store would need to do to stay safe. Now, that law would apply more to a situation where a customer ends up getting infected. Typically, the Safe Place law, if you're familiar with, it's been used for things like slip and falls, trip and falls at stores, and so it would be kind of interesting if it was applied to this context. I can say, and this is where a lot of this stuff is scary, but as a business, there's not a whole lot to fear in terms of liability arising from the Safe Place law. I'm not aware of any lawsuits. I haven't seen many lawsuits from around the country. There's only been really one of note that I can talk about, which is a Walmart in Illinois that did a lot of things wrong, and that's where a lot of the information in this presentation comes from. So that's one area of potential liability. The other one is workers' comp, which everyone's also probably aware of, and that would apply to an employee who ends up getting infected with COVID. The good news with all of this is that if you're a business, you have workers' comp insurance, and you likely have commercial general liability insurance that would cover any sort of injury claim being made by a customer. So on both fronts, you're likely covered by insurance. And so that also decreases the burden and the worry on you as a business. Now, what are some things that a business can do, and where do you get that information from? First source, OSHA. If you go on the OSHA website, it says there's a duty under OSHA to provide employees with a workplace free from recognized hazards likely to cause death and serious harm. This would certainly be one of those. So I didn't have time to put together a PowerPoint, but write this down because this is the place to get some really good guidance on how to create your own playbook for reopening. OSHA put together a document called Guidance on Preparing Workplaces for COVID-19. First thing it says to do is classify the risk of your business. Every business is different. And it tells you what to do if you have low risk of people being exposed to COVID to very high risk. And obviously that's going to be in places like medical facilities. It also then goes into social distancing, staggering work shifts, downsizing operations if possible. But it gets into some very specific things about the type of sanitizer that should be used, how to wash hands. I mean, stuff that should be pretty simple, but is very good guidance. Then to the really, really basic things like telling people to stay home if they're sick and making a policy that actually informs your employees they should be doing so. And that goes into developing policies that would identify people and then isolate them and make sure that they're getting good information, and also providing that information to other employees if someone has been infected with COVID. The other part that OSHA is very clear on in terms of guidance is provide face masks if feasible and if available. They also talk about engineering controls. We touched on that briefly. Those are the physical barriers, plexiglass, sneeze guards, things like that. And that all, again, depends on the type of business you have. One of the engineering controls that gets to be a little bit more complicated that has been recommended in some environments is air filtering, and basically HVAC apparatus that can increase ventilation rates. Now, that's above and beyond probably what most employers will need to do, as long as they're doing a lot of these other things. Second place I'd look to find really good guidance is the CDC. They've got a document that they put out there, Preparing Workplaces for COVID-19 Outbreak. They give a lot of the same information that OSHA does about identifying people and then isolating them in the workplace, staggering shifts, telework, partitioning folks as well. One thing that they recommend doing is identifying one person in the workplace to coordinate the effort, kind of that has the database and knowledge on how the company is responding to certain things. The other thing I recommend every business do is go on the CDC website and download the posters that talk about what to do if you're sick, what you should know about COVID-19 to protect yourself, and put those posters up in your place of business. I don't want people to think lawyers engage in gamesmanship, and this isn't gamesmanship at all. It's real. But if somebody brings a lawsuit against your business, or an employee brings a workers' comp claim, it's very easy to point out that you did something if you can say, look, here's a poster saying exactly what we wanted you to do if you think you're sick. We also created policies. We had a coordinator who was working with people. All those things go a long way as to getting positive evidence that you took reasonable measures to prevent the spread. Another place that does really well in terms of giving guidance is Wisconsin DHS. They get very, very specific, and I won't go into all the things that they say because it goes down to basically taping off surfaces, how to do it, how often your cleaning staff should be cleaning desks, phones, things like that, increasing cleaning staff. But it's all stuff that should be taken into consideration. They also talk about plastic sheeting, plexiglass barriers that can be used, monitoring and isolating. And then the other thing that they give is an actual recommendation for employees who believe they've been infected or have been at a high risk for exposure, and that's a 14-day quarantine. There's other advice out there about how long folks should quarantine, but the DHS is very specific with 14-day. The other thing that businesses could consider, and this has kind of been floated around in legal circles, is exculpatory contracts. So informing your customers of the risks as they walk into your business, telling them what you're doing and saying if you enter, you're entering with the understanding that we're doing the best we can, but we haven't done this, this, and this. So almost like a waiver of liability. We don't know if they'll be enforceable, but that's something that has been talked about, because information is important both for your employees and for your customers, so they know what's going on. And then the last thing that I'll get into is kind of 4 factors that I look at for reopening. Local status of the public health crisis. So here it's what Gary talked about, the number of cases, how safe it would be in Portage County specifically. Second is what are the government officials saying, the city, the county, all the way up to OSHA, DHS, CDC, what we've talked about. The other thing that's outside of my area of expertise, but equally important, I always talk to businesses about this, is what's the community sentiment? Are you going to lose customers if you open early? And then the final piece of whether a business is ready to reopen is the store operational readiness, and that's all the guidance we just talked about, and I'm happy to make everything that I've cited today available. And with Dan, I'll take questions. I know I threw a lot at you, but that's kind of the nature of how this works. So thank you.
Dan, thanks so much. And it's a challenging topic, a lot of uncertainty in your field, just as there is in the health field and government and everywhere else. So thanks for sharing those thoughts. I did post on the chat box both OSHA.gov and CDC.gov and some specific links that'll take them to probably what you were talking about, Dan, in terms of those sites. I did not put on DHS, but if you Google Wisconsin DHS, you'll get to their site, and I'm sure they have a pretty prominent link to getting to that. Next week we'll have, as we mentioned, we'll have Brian on. Brian will be talking about more from the employee standpoint. sharing some of the concerns there. There weren't any questions that come through, but I think it's important. And if you have resources, Dan, you can send them to either Ryan or me or both of us, and we can get some of those posted on our portageeconrecovery.org. It's kind of our Central Wisconsin site for resources for businesses and all that. So if you have a couple specific ones, certainly send them our way.
Sure. And Todd, one thing I said I'd talk about but didn't get to was what happened with the Walmart case in Illinois. I'll just briefly share with everyone what happened there, because basically an employee there got sick and died, and filed a lawsuit, and it was actually the second or third employee that had died at that store. And if you read the complaint of what happened, so these are just allegations. I don't know if they're true or not. They need to be proven. But they looked at the CDC guidelines and cited it, and they cited the OSHA regs and said that particular Walmart store didn't do any of these things. They didn't provide PPE to their employees. They didn't isolate people. The management ignored people who had said they had had COVID. If true, there was a lot of failures there. So I'm not saying that to scare you, because there has not been a lot of litigation about this, but it's just, again, important to take some reasonable measures to prevent the spread. So.
Absolutely. Thank you so much. Well, there was a question earlier about the WMC back to business proposal. I can talk about that if we had time, and again, thanks, Dan, for being on the call. But let's because Ryan's on the agenda, let's make sure Ryan has a little bit of time. Ryan's a community development director for the city, and as many of you know, the city opened up a grant opportunity for some funding to help with rent, lease, mortgage payments. So Ryan, if you want to give us a kind of an update on that and any other nuggets.
Sure. Yeah. Thanks, Todd and Dan and Gary, for taking time this afternoon to speak with the group here. Again, as we go through this process and as we have these briefings, having a diverse group of presenters is really, I think, beneficial for everybody. So, last week, Thursday, the city opened up our COVID-19 emergency grant program. How it was structured essentially was $100,000 that we took out of our rainy day fund, if you will. And we were going to allow up to $2,000 per applicant to go towards their mortgage or their lease. And it had to be a small business, so 10 or fewer full-time equivalent employees. In the first 30 minutes of Thursday morning's opening, we had over 90 applications come in. In all, after we exclude some of the duplicates and some of the ones that weren't necessarily qualified, we had about 165 total requests for assistance from our local businesses here in the city of Stevens Point. And that's important because how it was structured was only for local businesses within the city's limits. And so, unfortunately, businesses in the village of Plover or outside of the city were not eligible for the grant. In all, we did provide assistance, or we've been kind of working through it after doing some of our due diligence, about the total $100,000 out to nearly 80 businesses that will receive assistance from us. And those will be announced likely this afternoon into tomorrow for those who received funding from the city. I should state that the total amount requested was roughly $235,000. So as we've had these conversations with our local businesses, knowing that, you know, you folks that are kind of the core of our economy here, you don't need loans, you don't need microloans and some of these liabilities that are going to come back to haunt you in the down the road. So, you know, we really listened. We put this grant program together, thus far wildly successful, and businesses should start seeing checks from the city that qualified, likely at the end of this week or early next week. So I'm super proud of the city and of the city council and Mayor Wiese and Comptroller Laddick for stepping up and taking what was kind of a crazy idea and putting pencil to paper and working through it. So that's kind of the update. There's no more money coming in or no more money going out from the city's end, but those businesses who did qualify will be getting notified, like I said, either at the end of the day today or tomorrow.
One question that just popped up, Ryan. I'm assuming you'll also notify businesses that were not approved that they aren't receiving the money?
Yeah, those businesses that were not approved, are going to, get a letter or an email stating, here's why you didn't approve. Here's why you weren't approved for a grant, and ways, down the road, if there's opportunities for them to create a better application down the road, we may include that as well. So everyone who applied will get notified.
I think the other thing to remember too is that every organization, whether it's a federal government, state government, city, village, everybody has limited resources. And
Right.
this is great for the city to offer this, and let's focus on that part of it when you're posting things in Facebook and elsewhere, that this is a great opportunity, albeit it was limited. And I know that other communities around the area are looking at the possibility, but everybody's in a different boat. So appreciate that from the city. Anything else, Ryan?
Nope, I don't think so.
Okay, so let me do a quick rundown on the WMC, Wisconsin Manufacturers and Commerce, which is the state chamber of commerce, put a proposal forward, just a proposal, to state government as a way to open up the state to the business community. And they took into account a lot of factors. There was actually a presentation this morning. It was about a half hour. And I'm not going to spend that much time. I'm just going to skim across it really quick. But if you go to WMC for Wisconsin Manufacturers and Commerce, WMC.org, O-R-G, you can find the details of the plan. But essentially, they took 4 factors in to ranking businesses in terms of their ability and their risk in terms of opening. They looked at population density, infection rate, the risk of the business, and the healthcare capacity of the community. And what businesses simply do is enter into this database, the name of their business, the county they're in, and their NAICS code, the type of business that they are, and it returns to them what their risk is in terms of a business. For example, a business like the Chamber of Commerce, we'd be very low risk because our community, the county has a very small population density. We're not a high risk business necessarily, whereas a restaurant might receive a higher risk rating. And those can actually be posted on windows, so as people from other communities would come in, if that were the case, or people in the community have an understanding of the environment in that particular community. For each of those different levels, there's also mitigation risks, or mitigation, what's the word I'm looking for? Things that they can do to mitigate the problem. So for example, in a restaurant, if you're at a higher risk, you may only be allowed to achieve 50% of your rated occupancy. If you're at a medium risk level, you might be able to achieve 75%. And there's a lot more mitigation criteria in each of those 3 different levels. But they talk to healthcare, they talk to a variety of different resources. And again, there's a validation date on these, so as factors change in the community, if the infection rate were to increase in Portage County, that would change people's the business risk, so to speak. So that in a nutshell is what the plan is. I would suggest that if you're interested, go to that website and look at some of the details. One question that popped up: is the WMC risk rating system just proposed, or is it active now? It is proposed only, right? The governor's order is in effect right now. We realize that the governor's order has been challenged by the state legislature. That's going to be addressed in the next day or two. But the WMC is strictly a proposal. If it were to be approved, it would have to be approved by the legislature, signed by the governor, and then the Wisconsin DHS, Department of Health Services, I believe that's what it's called, would be the ones that would actually run this program. So that's a short answer to a long question. And I don't see any other questions on the chat box right now. Next week, again, we'll have Brian Formella from Anderson O'Brien talking more about from the employee standpoint and businesses reopening. We'll have the state tourism director, Sarah Meany, on, as well as Sarah Brish, our local tourism director, the 2 Sarahs. And then we're looking for somebody from WEDC, Wisconsin Economic Development Corporation, part of state government, to come and talk about some of the business aspects of returning and opening our businesses. Ryan, any last minute touch points for you? No?
No,
Yep.
I don't think so. Thanks again, Todd and Dan and Gary for taking time today. And again, portageeconorecovery.org. If you want to find one centralized location for anything that you might be looking for in terms of kind of the local economic recovery efforts or response efforts. Again, I encourage you to reach out to Todd or myself or anyone on the team, and we'll try to answer your questions as best as we can going forward. So thanks again for taking time this afternoon out of your busy schedules to listen in, and hopefully we provided some great insight for you folks.
And the recordings will be posted for sure within the next 24 hours or so. So we'll see everybody next week, same time, same place. And thanks so much for participating.